Tiffani Dusang, and this case study presentation is for Nursing 5309, Teaching, Learning Strategies, Theories, and Evaluations for Professor Dolores Aguilar. And today we have 3 forensic nurses who have just finished their course work, their learning work, and they're now applying what they've learned to clinical practice. We have Dana, Lashade, and Laurel. Okay, so just to let you guys know, we're going to do a 27-year-old domestic violence patient that had strangulation, okay? And these are my learning objectives for you today. I really want you to be able to recall, recognize, and summarize those key concepts in the patient history that you learned in class, okay? Maybe even what you've already seen on some of your patient experiences. Then using critical thinking, analyze, break down, differentiate, interrelate these concepts, know what they're consistent with, because we keep one eye on the patient and one eye on the courtroom. So you need to know what these things are consistent with. You're interrelating all these concepts and thinking holistically, okay? Then I want you to be able to create and evaluate a holistic plan, and we want to devise clinical judgments that are based on best practice, okay? All right, so what are the 4 parts of the medical forensic exam real quick?
The history, the head-to-toe assessment, looking for any trauma, detailed genital assessment if needed, and then the collection and preservation of evidence.
Perfect. Good deal. And so why do we take a history?
To diagnose and treat our patient.
Right, leads our assessment. So we've got our patient from the emergency room. Everything's been done. They're in the forensic room. Consent's been signed. All the preliminary data has been collected. So we're starting with the first part of the medical forensic exam, which is her history. I've already learned a couple of things for sake of time, just to draw your attention. Okay, patient states, he told me he would never do this again. I always believe him because I have nowhere to go, nowhere to stay. Tonight, I knew I had to get away. This time, I knew he would kill me. He had been drinking. He grabbed my phone and said, "You slut, I know you're sleeping around on me." I said, "I'm not, I swear, give me back my phone." He started yelling, and I was begging him to calm down. I told the kids to go hide. He kicked me out of my chair. He then pulled me up by my hair and dragged me to the bedroom and threw me on the bed. He started choking me so hard I thought my neck would break. Things got fuzzy, went black. I thought I was going to die. I was kicking and was able to get out from under him and run to the door. That's when I heard the police. The neighbors must have called. He took off running it out the window. I'm so scared. So what are some key concepts in here? What's one of the first things you want to think about for this patient?
Her safety and our kids' safety.
Very good. Her safety, that's very important. What about her safety?
I'm going to make sure she's been placed under an alias and if the police have taken a report.
Right, so she has been placed under the alias, the police have taken a report, her immediate environment is safe. And that really is one of the first things you want to think about with a domestic violence patient. What's the second thing we want to note?
She thought she was going to die.
She thought she was going to die. Why? What happened to her?
She felt like her neck was going to break, things went fuzzy, they went black.
That's right. What was he doing to her to cause all those things?
He was strangling her.
He was strangling her. So that was the big deal. Now she called it choking. We never use choking, only when it's in quotes, right? But you're right. It's the pressure. She had fuzzy and went black. What's that consistent with? Fuzzy, black, goes out.
Memory loss. Memory
loss, perfect. And she thought she was going to die, which is a big deal. And I'm glad, Laurel, that you picked up safety and kids. So that's good. Let's underline that. Okay. So while you're talking to her, y'all picked out some good things in the history. Her voice was very garbled, and it was very hoarse. What are you concerned about with a garbled voice?
Concerned for a hyoid bone fracture.
Hyoid bone fracture, good. Good. And so what does the hyoid bone do?
Controls the tongue.
Controls the tongue. So that's why her voice may sound garbled. So that's definitely something you want to note. Now, hoarse voice, what are you concerned with there?
I'm concerned about the larynx being fractured because it only takes so little pressure to block the oxygen to go to the brain. 33 pounds of pressure to occlude the windpipe and only 10 pounds of pressure to occlude the vessels that bring the blood to the brain.
Very good remembering. That's great. Yes, that's right. 10 seconds, occlusion to the vessels, blood flow to the brain, and you'll have unconsciousness in 10 seconds. Once that pressure's gone, they can wake back up. So you can have in and out memory loss or a fuzzy kind of experience. Good. A handshake is how many pounds of pressure? 80 pounds of pressure. So not a lot of pressure to rob the brain of oxygen, right? But she said there's a lot of pressure, and so we need to take that very seriously. Now, we do our head-to-toe physical assessment, so let's look at some injuries that we found on her neck. How often do we even expect to see external injuries to the neck? The big misunderstanding here that people have.
50% do not have injury.
50% do not. How many just have maybe a minor injury? Not even enough to really photograph.
35%.
35. And then how many of them have significant external neck injuries?
15%.
15, right. So this is actually pretty rare, and it is concerning for the amount of pressure, but we can have underlying neck injury and no injury to the external neck, and that's information that has to go back to the providers, right? So what we see here are what?
Horizontal bruising, which is cluster bruising, consistent with fingers.
Consistent with fingers, very good. All right, that's a close-up of those. That's right, linear bruises. Okay, how about this one? What do you note in this picture?
Those are vertical wide abrasions, which are consistent with the claw marks. We're just trying to get away.
Trying to get what's on her neck off. What's another finding you see there?
A single bruise to the neck.
That's right.
Is consistent with the assailant's thumb.
Perfect. So the assailant's thumb, good. So single bruise to the neck, assailant thumb, vertical handprint here, fingers can cause bruises, clustering bruises, and then the claw marks. All these are things you'll use trauma terms with, we'll measure, we'll photograph, but then you testify to what it's consistent with when it goes to trial. So that was very good. All right, sounds good. What are some other real quick things you're going to look for in strangulation? Very important. You're going to have what kind of form to get this information?
Strangulation form.
So what? Just name some things you're going to be looking for very carefully.
Petechiae.
Petechiae, that's over 20 seconds of pressure on the jugular veins, right. So you don't always see that. How about, what else are you going to be looking for?
The hoarse voice.
Hoarse voice.
Any kind of bruising. Subconjunctival hemorrhaging.
Right, how do you look for that?
Pull the eyelids down.
Pulling the eyelids down. Perfect. Good. Okay, so a very thorough assessment on strangulation. And what's the last thing that she said here?
I'm so scared.
I'm so scared. So what does that tell you?
Scared for my life.
Scared for her life. So what do you need to address there?
For safety.
For safety. Good. Very good. So let's just look at kind of what we want our plan to look like for her. Laurel, you said safety, right? So let's address her safety as an action plan, okay? We want it holistic and based on best practice. Who do we need to call here for safety?
Contact POC.
POC. Houston Area Women's Center. What will they do for her?
Give her shelter.
Get her shelter. That's right. Get her counseling. Good. What else do we need to do?
Contact the police.
And make sure what's going on there.
Restraining order.
Restraining order, warrant. They're scared. They don't know what's going on with their husband. Okay, how about what else?
Kids welfare. CPS.
Kids.
CPS.
Good, we gotta call CPS. Good, now let's look at our strangulation. What are best practice based on research? What's the gold standard we want to do for strangulation, test-wise, to recommend to the physician?
A CT scan.
CT scan. CTA of the neck.
Possible 24-hour observation.
Possible 24-hour observation.
And a danger assessment form.
And a danger assessment form. Good. Now, why do we do a danger assessment?
It helps the patient understand how likely they are to be killed.
That's right. Strangulation and domestic violence, 90% correlation. Remember, if there's strangulation, how much more likely will you be an attempted homicide?
6 times more.
6 times. Good. How much more likely to become a completed homicide?
7.
7 times. This is key and important, okay? 24-hour obs is recommended, especially when they say, I thought I was going to die. Okay? CTA of the neck, perfect. This is based on research. Do y'all remember the research you look at? The name?
From Strachan McLean.
Strachan McLean, perfect. And this is looking for the underlying neck injuries you mentioned, Dana, the fractured larynx, occlusions and tears to the vessels, remember, just swelling in the neck. That's why this 24 obs is good too. If the physician doesn't want to do this, you can bring the research to him, right? But they depend on us as forensic nurses for this information, okay? And then last, y'all said psychological. How are we going to help her there? Who can we consult for her psychological care?
Well, we're going to get her into counseling.
And who does that for? POC. So again, it's Houston Women's Center. Don't we love our advocacy centers? They take care of counseling, shelter, and we call them on site. So do y'all feel good about the safety plan? Do you feel good about this action plan based on best practice?
Yes.
All right. Well, thank y'all for being a part of this case study.